Dr. Ferrer says she learned from residents that personal touch matters. Now, as for the COVID briefings themselves, she says they'll be scaled back quite a bit and only be held when needed. So for more on this, let's bring in board-certified emergency room doctor Michael Daignault for our medical roundup. Dr. Daignault, nice to see you on this Friday. Let's get your reaction to the COVID emergency ending. What do you make of that?
So honestly, I think it's a bit bittersweet, right? And certainly because of vaccination, updated boosters, availability of treatment, I think the public health emergency to the hospitals probably started ending over a year ago now. But we have to remember that we lost 36,000 LA residents to COVID, and many of them were before vaccines were available, but a lot of them were after. So I think we still have a lot of work to do. Unfortunately, public health has gotten bogged down in politics, you know, not just in LA, but across the country. So I hope that the end of the public health emergency is the beginning of a time to reflect and try to learn some lessons about how we can reclaim that public trust in public health and to prepare for the next pandemic.
Hopefully, yeah, let's hope that there's not another one in our lifetime anyway. One of the issues is, as of Monday, the California State Department of Public Health lifted the masking requirement for healthcare providers, except here in LA County, that will remain. So I asked Barbara Ferrer that today, why this one-way masking policy, because patients don't have to wear the mask, and here's what she told me.
I do want to note that LA County is not alone. San Francisco County, I believe Alameda County, are also requiring extra protections in their healthcare settings. We have worked with the healthcare providers and heard from them that they would appreciate some flexibility at their sites.
So she didn't explain exactly why this is happening here, and you heard what she had to say. What do you think?
So I think if the priority is to protect the patients, which it seems that is her and the county's priority, and to having us wear masks. I mean, the way one masking works is no matter what anybody else does or what they wear for a mask, if the patients themselves are wearing a high-quality mask, that is the best way for the patients to protect them. And again, I think as I've mentioned here before, I think it should still be a shared decision between the doctor and the patient based on assessing the risk and what's going on in the community as far as levels of virus circulation.
All right, I've got a question for you, but before I ask my question, I have a question for you. You've been going to these things, often the only person there. You've been on the phone, the Zoom with Dr. Ferrer for 3 years now.
3 years, yeah.
What did it feel like for you for this to be sort of the last briefing?
It was a little surreal, especially because, Alex, as you noted, I'm often the only one there. Today, there were several cameras. So I walked in because I usually have the one-on-one with her, and I wasn't used to having to share the microphone. But it was sort of a put a button on it, put a bow on it, and a sense of relief that we've made it out on the other side. And of course, noting that there have been a tremendous amount of loss. There has been. So I do keep that in mind.
Yeah, and of course, the vaccines have been helpful in limiting the number of people who have died. Let's talk a little bit about vaccines on a federal level. The federal government is winding down its own COVID emergency. And when that happens, one of the big changes is that insurance companies or individuals will now have to pay for their COVID vaccinations. Remember, they've been free for most people this whole time. Moderna plans to charge $130 a shot, a lot more than they're charging the government. Bernie Sanders, of course, the senator from Vermont, grilling the CEO of Moderna about that. Take a listen.
Your vaccine was developed with the help of the United States government. I am asking you whether or not we are going to continue to pay the highest prices in the world for that vaccine.
I cannot say that the price will be lower than other countries.
All right. What do you think about that? And there's a lot of people that are going to say, look, this all was, you know, the insurance companies and the pharmaceutical companies trying to make money off of us. That doesn't help with the whole conspiracy theory thing either.
Right, so pricing of vaccines is complicated, and we have to remember last year, Pfizer announced that they were going to charge $130 per dose, but they didn't get raked through the coals like Moderna, and the reason for that is because Moderna received $12 billion in public funding, taxpayer money, for their R&D. Pfizer chose not to go that route because they didn't want to be held to this kind of congressional hearing where appealing to their altruism and saying, hey, you got taxpayer money, why are you charging 4 times the cost for future vaccines. And so, honestly, I think it's a bit naive for us to expect a pharmaceutical company, Moderna, for example, this is their one product that they've made billions in dollars in sales. And this is a free market capitalist society. And so the problem was when the government was negotiating with the pharmaceutical companies and Moderna back in the day with Operation Warp Speed with the Trump administration, they chose not to include that injection in their discussion and to request a fair price after this was all over. So I think that was a huge lesson learned for us for the future.
Well, a free market capitalist society would not give Moderna all those billions of dollars in government funding. There's got to be a deal there, right? If you help me, I help you.
Yeah, but again, we have to understand that, as any company, no matter what their product it is, whether it's a pharmaceutical company or not, like they are going to try to maximize their profit.
Yeah.
And so they're looking at the future now. We're ending the public health emergency. There's going to be less demand for vaccines. How do we continue to make money off our product?
Yeah, rubs a lot of people the wrong way. All right. Dr. Daignault, thank you.
Thanks, Doctor.
Great to see you.